All right, welcome back to another Wellness Wednesday. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Medical Group. Wellness Wednesday is a time where we're bringing important topics to you, the public, so you can better understand your health and keep yourself healthy. Today I have a guest, Dr. Cynthia Gneco, who's one of our new providers and physicians over at the Holy Cross Clinic, as well as Las Palmas Clinic as well, too.
Yes,
great.
I am. Mm-hmm.
Well, thank you for joining us. To start off, you want to just tell the audience a little bit about yourself and kind of what you're doing?
So I moved recently to San Antonio around 3 years ago. I used to live in Connecticut, practiced there. I was actually faculty at Yale University for that amount of time. So after doing internal medicine, I went ahead and did some geriatric training. And that's basically it. Some friends ended up coming here to San Antonio, and I love it.
Well, great. Well, we're glad to have you here.
Thank you.
And today, a pretty important topic, especially for right now, for multiple reasons, with the holiday season coming up, everything that's been going on with the pandemic. I know I've seen a tremendous amount of issues with just mental health problems and depression.
Yep.
Can you tell me a little bit about what maybe holiday depression is? Something we see commonly during this time of the year.
So holiday depression is the common names of what we know in medicine as a seasonal affective disorder, and it's basically a subdivision of depression. And when it comes, you have a 2-week period of times in which you're feeling down, you are feeling as though you can't perform your regular activities, whether it's sleeping more, sleeping less, eating more, and not being yourself. And it's defined as the period of the beginning of fall and on March, April, depending on the equator.
Yeah, it's something that we see kind of every year, like you said, around this time frame.
Yeah.
Days are shorter, nights are longer. That can kind of weigh on you a little bit, not getting as much sunlight. And then really the isolation, right? I mean, that tends to happen more commonly during the colder months.
Yep.
Being alone, not being able to interact with family and friends, and especially during the pandemic, it's just been a tremendous problem that we've kind of faced.
Right. It's an add-on to the fire. I mean, the fact that we cannot interact as much as possible, because remember, depression is not per se what you have, and the disease that you have is the fact that you're dealing with alone.
Not often is it easy to express that maybe you're feeling depressed or that it's even an issue. It can be kind of a slow-moving thing, especially now with the pandemic for the last 6-8 months.
Right.
If you have a family member or you notice that one of your family members is maybe just kind of acting different, you're not sure what's going on, how can you better identify, maybe they're going through depression?
Right.
What can you look for?
Some sign and some symptoms, it could be just as I'm not sleeping very well, or, oh, mom is losing some weight. Or, for instance, she used to knit a lot. She used to talk with her granddaughter a lot, but now she's changed. She's falling. It's one of the symptoms. And in the younger population, it can happen too. They can cope during those 8 hours at work, but then when they go home, they don't go out. They put the blinds down and they don't interact as they used to. So it's very faint symptoms. Now, for the family members, unfortunately, that don't interact as much as our patients, it's difficult to identify because we are not face-to-face anymore in the last few months. So it's challenging. Nonetheless, when there's a change in behavior, there's no better information than just to ask.
Yeah.
Yeah.
Yeah. It's come up a number of times over the last couple months where the patient who's kind of describing things like you're talking about, my thinking is just not there. I'm getting, delayed in my work. I don't have much motivation. I'm sleeping too much. I'm eating too much, something like this. And I'll just ask them, do you feel depressed?
Right.
And it kind of just hits them. You know what? I think I am.
Right.
So people asking that question, if you feel like something is off with a family member or a friend and something's different, it's okay to ask that. And of course, if you're coming to see your doctor and you feel like something is going on, make sure you bring it up so that we can help out.
That's right.
Okay, so what are some good ways to maybe prevent the holiday blues with the season changing and everything coming up? How can we maybe fight this off a little bit?
It comes to first identifying the problem. Yeah. And depression is often called in the geri world as pseudo-dementia because you tend to forget things. You tend to not express it. But when those things are identified, it's first exercise what we call mindfulness. Be aware of the problem. Be aware of the fact that you have it. And then multiple things that we can do, practical, non-related to medications, is things like exercise, and it's being well studied. 30-40 minutes 3-4 times a week, and eating healthy, because the same thing, remember, the same thing that you do for your heart is good for your brain. So eating your veggies, low salt, low fat, things like walking in the park, walking your dog, practice gratefulness, being aware that, hey, I woke up this morning, I'm alive. And that meaningful, advisable thing is to, make sure that you take care of yourself, but often than not, when you take care of orders like volunteering, things like that, going to church, going to a soup kitchen, because it's well known that when we practice kindness, we think of our problems in perspective, right? So that changes our perspective in life, because it's not a magic pill. I wish that there was a magic pill that we can give our patients and say, hey, that's it, you're done, you're not depressed anymore. But it comes with first mindfulness, and that's the hard part to exercise, the mindfulness.
Yeah, I think those are all really great points and things to continue to do. And a lot of what you're harping on is kind of a routine, right?
Right.
Getting back to that, going to bed at the same time every day, waking up at the same time, exercising every day. These things can really do a lot for mental health, keeping anxiety, depression, all these things at bay. So great points, thank you. So let's say we have somebody out there that's watching this and they feel like, maybe I'm having a little bit of depression problems. So when should somebody go and seek professional help? When should they come and see us?
So when those symptoms where you're not yourself or your family members is not yourself for a period around 2 weeks or so, or even when it's disrupt the daily activities, whether it's going to work or you're missing a lot of day at work, or I'm losing 5 pounds, 3 pounds in a week that I was not planning to do immediately, call your PCP, your primary care. And we are there to listen first to the problem, because sometimes, I'm pretty sure they happen in your practice, sometimes patients come and they don't have anything wrong with them, they just want to talk. And the highlight of their day is the visit to the doctor. So that listening part, in our part, we so often than not, we fail to listen. And when we listen to those things, we can identify those signs, those little faint signs and red flags that our patients have. But resources are PCP. You can literally just pick up the phone, call 311 Crisis Center if you have any thoughtful of hitting yourself with suicidal ideas or having a plan. And if you Google literally depression in the U.S., the U.S. State Department would go, that's the first, actually I tried it myself, that's the first link. And there are many resources for every state.
One thing that I feel like does happen a lot more than I just don't know too much about it is if, I do have a patient that is really experiencing significant problems with depression, but maybe they're just not ready to really say they're depressed. They're kind of scared of that stigma of, I don't have mental health issues, I'm okay, it's just a tough time. Well, what kind of message do you have for them if we have some patients that are going through that?
Just ask about their support system. Who will be there in the middle of the night if you have those thoughts? Who would you pick up the phone and call? It depends on the relationship that you have with your patient. It's hard in the first visit for them to open, hey, I'm having depression. But maybe in the subsequent visit, you can pick up the flags and just literally take 5-10 minutes and talk to them.
Great points. And again, if you're having any problems with depression, anxiety, mood, stress, this is a whole spectrum of conditions, really. Especially during this time, the holiday season, pandemic, all these kinds of things. Please seek help, and any resources that you have that are available to you. If you do have a primary care doctor, go visit them, talk with them, explain how you're feeling, and let's try to just make you feel better. That's the bottom line here. Can you give us a little bit of education about when to use medicines, and should our patients be scared of them? Does that mean that they have major issues if they need medications? What information can you give us?
That's actually like 4 questions in one. But what I would say is this. It's been well studied. Exercise and the talk therapy, this cognitive behavioral therapy, has been more efficient than any pill that I can give you. There are multiple medications, the SSRI, non-SSRIs, gabapentin, electroshock therapy, TMS. There's a lot out there. Not necessarily everything is good for you. You tailor it for the patient, and what is being proven to work is non-pharmaceuticals first.
Like you said earlier, there's no magic pill that's just going to make you feel happy again.
No, I wish there was. We wouldn't be in this business if it was. Yeah.
And like you said, the first line treatments for mild to moderate depression is cognitive behavioral therapy. So talking, counseling, and then like you said, exercise. There's so many benefits to that, especially for mental health.
That's right.
Really should be trying those first before we really get into medications. So great points. Well, I think that's pretty much all the time we have for today. I want to thank Dr. Gneco for joining me today and giving us some great information on holiday depression and some mental health tips. Really appreciate it.
Thank you.
Thank you guys again.
Bye.
And just remember, currently right now it's Medicare's annual open enrollment all the way through December 7th. So if you have any information or you want any information about Medicare enrollment or Medicare plans, please just give us a call on the number below or visit any one of our 17 locations. Y'all have a wonderful day.